This is the second in a series of malpractice cases designed to help office staff understand the importance of their role in protecting patients and avoiding malpractice claims. I'm Denise Chamblee, and I look forward to reviewing this case with you. So this case involves a 5-year-old boy who went to the emergency room. It's right up my alley, obviously, since I'm a pediatric ophthalmologist. So this little boy stabbed himself in the eye with a toy, supposedly accidentally. The emergency room doctor saw him and said, I think he has a corneal abrasion. So he called the ophthalmologist, and really the ophthalmologist didn't ask too many questions. He just heard the emergency room say that this child had a corneal abrasion. So he said, no problem, let me see him tomorrow in the office. So the child came with his mom to the office the next day. Unfortunately, they were quite a bit late. In fact, they were about an hour and a half late because the mom had overslept. Well, the front desk said, we have a policy here at our office that if you're more than 15 minutes late, we really can't see you. And by the way, you have some insurance issues which might require you to make a payment for today's visit. Now, the ophthalmologist didn't even realize that the patient didn't come in. He had forgotten about the call that he had with the emergency room that night before, and so at the end of the day, he didn't even realize that this patient didn't come in. So that day, the patient went home with his mom, and he kept his hand over his eye, and he was pretty uncomfortable, kind of tearful, not very consolable. And so the mom said, I just think something's wrong here. And so she went back to the emergency room the next day. Unfortunately, this was not a corneal abrasion. It was a corneal laceration. So there was actually a full thickness cut through the cornea, and it had gotten infected. So he had a hypopyon, which is basically pus inside the eye, indicating this infection. And more unfortunately, he ended up legally blind. So what can we recommend to do better for this little boy? So the doctor obviously had some responsibility in this case. He would have wanted, ideally, to communicate with his staff, hey, I've got this little 5-year-old boy that's coming in today. This is an emergency. I was called last night by the emergency room, and I want to make sure that he gets in today. And maybe, by the way, well, if he doesn't, let's make sure we get in contact with him. Also, in the ophthalmologist's conversation with the emergency room, he probably should have asked some additional questions. In other words, he wants to ask, okay, well, how did this patient get a corneal abrasion, not just, oh, well, it's a corneal abrasion, I'll see him in the morning. And that might have led him down a different path. He might have said, oh, stabbed himself in the eye. That probably doesn't sound like it could be a corneal abrasion. Or maybe it's something more serious, and I want to have a look earlier. I want to be more careful about seeing him in a timely manner. Finally, there was no documentation from the doctor or from the ophthalmologist or from the ophthalmologist staff. So the emergency room doctor had written down that, hey, this is a patient that I spoke to the ophthalmologist about, and he has a corneal abrasion, and the ophthalmologist said, fine, I'm happy to see him in the morning. But unfortunately, the office staff didn't write down why they turned the patient away, what happened, and the ophthalmologist didn't document his conversation with the emergency room doctor. So when can we turn a patient away? I mean, is it okay to turn a patient away because they don't want to pay and their insurance isn't going to pay for their visit? Is it okay to turn them away if they're late? What if the doctor's not in the office that day? Can we just say, I'm sorry, we don't have a doctor here, and so we're not going to be able to see you today? Well, obviously it depends. So when a patient is tardy, they have insurance issues, it depends on how urgent the problem is. Now, in this case, the front desk had no idea that this was an emergency patient. The doctor didn't communicate to them that this was somebody that they really needed to see right away. And if there's no doctor in the office, then again, this depends on how quickly the patient needs to be seen. If this is just a routine visit, then they can be rescheduled. But if not, this is something that requires an office policy. So office policies are extremely important. It needs to be clear, when can you reschedule a patient? If this is urgent or emergent, how does the staff know that this is somebody that needs to be seen right away? Obviously, we need good communication between the staff and the doctors. The staff needs to be able to say to the doctor, hey, I'm not sure what this patient is here for, and is this somebody that you want to see, or is this somebody that I can reschedule? Always we want to document, why did we turn a patient away? If you spoke to the doctor and the doctor said, okay, well, this is somebody I can see in another month or another few weeks, that's something that you want to document in the patient's chart so that you know why the patient was rescheduled to another day. So we also want to make sure that we take care of patients that don't show up for appointments. Sometimes patients have problems that aren't urgent or emergent. Say, for example, a glaucoma patient. Glaucoma patients may lose vision, but it may be over weeks, months, years. And so if they don't show up their appointment over a long period of time, they can still lose vision. So we want to make sure that we try to protect them and at least make sure that they understand that their condition can cause them to either go blind or lose vision without coming in for the proper treatment. We want them to understand that there's a risk of them not showing up for their appointment and what those risks are. On the OMIC website, there is a no-show policy, and you are welcome to use it and download it. So why are you important in this case? You may not have any control about the conversation between the ophthalmologist and the emergency room, but you probably can do better with communication between yourself, the staff member, and the ophthalmologist. This may be in the form of making sure that you know who the ophthalmologist communicates with on urgent or emergent patients. Maybe there's a better way to make sure that everyone knows that you're expecting this patient who was seen in the emergency room or who's an emergency patient. The urgency of the visit is also obviously really important. There needs to be a system where the person checking the patient in at the front desk knows, hey, this is an urgent visit, and I need to make sure that no matter what, I communicate with the doctor that this patient either has an insurance issue or they were late, and make sure that you know when the patient really needs to be seen and when the patient can be rescheduled. Again, clear office protocols will help with all of these issues. So what about you? Could you have turned that patient away? Well, it seems like in this presentation, when you're sitting here away from patients, that, hey, I would never, ever turn a child away that had an emergency. Well, that's easy to say when you're not at the front desk, lots of patients checking in, you're in a hurry, you feel like you're behind. So I always like the motto, treat patients like family and friends and treat family and friends like patients. If you stop to take a breath when you're sitting there at the front desk and everything seems chaotic and hectic, if you take a minute and just say, what if this little boy was in my family? What if this 80-year-old was my grandfather? Then you're probably going to always do the right thing and make sure that you have good communication and make sure that the patients that need to be seen are seen in a timely manner. So our office policies are important, not just because they might lead to a malpractice case, but because those policies protect our patients. Any questions? We're happy to hear from you. Please email us at riskmanagement@omic.com.